Hi, my name is Adriana English. I'm going to be your physician assistant student today. The purpose of this assessment is to perform an abdominal and a musculoskeletal exam on you. So if you can please use the restroom to ensure an empty bladder at this time, along with taking off your shoes, shirt, and socks for me when you're ready, while I go and wash my hands. Right. You can lay down for me. Lift this out. And extend your knees like that. Arms by your side. All right. Now that I have exposed patient from her cyclic process down to her symphysis pubis, I can now inspect the contour of her abdomen, noting any striae, any scars, any distension, any pulsations, or any obvious masses or anything like that, and the condition of her umbilicus. And also, before we begin, I would just ask if you have any pain in the abdomen area.
Nope.
Awesome. Right, so first and foremost, I'm first going to also tape your abdomen. Gonna note any bowel sounds in the area in all four quadrants, noting if they're normal, active, hyperactive, or hyperactive. So do that. And if I don't hear them immediately upon auscultation, I would stay in those positions for 1 full minute. That's fine.
Mm-hmm.
Right. All sounds seem normal, active. And now that we've auscultated, I'm now going to percuss in all four quadrants, listening for any tympany or dullness amongst the areas. And I'm going to also percuss for splenic enlargement and along the left and anterior axillary line, the lowest intercostal space. So. Right, and go over here to your spleen, to your axillary line, and can you take a deep breath in for me and out? Awesome. Right, now that we've percussed, we're going to move on to palpation. I'm going to ask you again, do you have any pain? Nope.
No.
Alright, so if she did have pain, I would have her point to the area where she felt that pain, and I would palpate that place last. First, I'm going to palpate lightly. I'm going to use one hand and about 1 centimeter deep, going across all four quadrants. Noting if there's any signs of distress by looking at her facial expressions, and note any signs of or presence of superficial masses. Right, now that I've palpated lightly, I'm going to move on to palpating a little bit deeper, about 4 centimeters deep, using 2 of my hands in all four quadrants, noting any signs of distress or pain, and going to state if there's any presence of deeper masses. Alright, I'm now going to palpate your liver for any enlargement, masses, or tenderness. So I'm going to place my left hand under your right rib cage, and then I'm going to place my right hand under your right rib cage. Can you take a deep breath in for me and out? Some. And then I'm going to do the same thing over here. I'm going to put my arm across you, place underneath the rib cage. For your spleen in your left upper quadrant, can you take a deep breath in for me and out? Awesome. There should be no tenderness or anything there. Right, now that we are done with palpation, we are moving on. I would now perform CVA tenderness. So if you can sit up for me, and I'm going to place my left hand onto your back, and you're going to feel a big thud bilaterally. I'm going to do it on your left and right at your lowest 12th rib. All right, so that seems good there. And now I would perform a rectal exam at this time. Now that we are done with the abdominal exam, we're now going to move forward to the musculoskeletal exam. I will now palpate and inspect for symmetry, signs of inflammation, edema, effusions, any malalignment of bones or deformities, any crepitus, atrophy, any abnormal movements, any crepitus, and any in the condition of her other types of areas. And so now that I've inspected that, I'm going to move on to inspecting your spine. So I'm going to inspect your posteriorly and anteriorly, your posture, looking for any the alignment of your shoulders and your pelvis. And I'm also going to look at your spine or your posture laterally, looking for any lordotic or kyphotic curvatures. And then I'm also going to be taking a look at your spinous process, your prevertebral muscles, your scapula, your trapezius, your sacrum, and your SI joints. So now I'm going to palpate your spinous processes, your prevertebral muscles bilaterally, scapula, and your sacrum, and your SI joints. All right, and now that I've palpated your spine, I'm now going to move on to, since we're up and at 'em, we're going to start your range of motion for your cervical spine. So please have you look up for me, and you can please look down, flexion and extension, and then can you turn your head to the left and then towards me. Awesome. And then can you move your neck to your left ear to your shoulder, lateral bending, and then to your right ear to your right shoulder. Awesome. And then so now we've done cervical spine. We're going to move on to your lumbar and thoracic spine. So I'm going to first assist or stabilize your hips, and I'm going to have you touch your toes for me. Good. And then I'm going to have you bend all the way back for me, extension. Awesome. I'm going to have you rotate to your left and then towards me. Yep. No, you're good. And then I'm going to have you take your right hand and slide it down your right side of your leg, and then on the opposite side as well. Awesome. And now that that's done, I'm going to do your TMJ range of motion. So I'm going to first have you open and close your mouth for me, then left and right, and then you can protrude and retract your jaw, so you can stick your jaw forward and then back. Okay, cool. So now that we have done that, I am going to now inspect your upper extremities. So I'm going to inspect your clavicle, your acromion, your AC joints, your scapulas, your proximal humerus, and yeah. And now I'm going to palpate those areas bilaterally. So your clavicle, your acromion, your scapula laterally, and your bicipital groove tendon. Alright, and now I'm going to be inspecting your arm, looking at your triceps and biceps. I'm looking at your lateral and medial epicondyles. I'm looking and inspecting your olecranon process and your proximal radial head. So now I'm going to palpate your triceps and biceps, your medial and lateral epicondyles, your olecranon process, and your proximal radial head. And also I'm looking at your antecubital fossa as well. And then now moving on to the forearms, I'm inspecting them. I'm also inspecting the ulnar and radial spondyles, styloids on both forearms. And then I'm also inspecting the carpal bones as well there. Okay, so now I'm going to palpate the forearm, the medial the radial and ulnar styloids, and also the carpal bones on both sides. So the forearm, the radial and ulnar styloids, and the carpal bones. Right, now moving on to the hands, I'm inspecting the carpal bones, the MCP joints, the interphalangeal joints, and also the anatomical snuff boxes. So now I'm going to palpate each of those areas, so the MCP joints, in both hands, and then also the interphalangeal joints, sides, and then also going to palpate the anatomical snuff box. So can you go like this for me? And awesome. So now that I have inspected your upper extremities, we can move on to your shoulder range of motion. So I'm going to please have you extend your arms, flexion, and then all extension all the way back, and then also you're going to abduct all the way, and then adduct across like that, and then we're going to have external rotation, so like football sign, and then internal rotation, and then we're going to have you do circumduction. Right, and now moving on to elbow range of motion. So I'm going to have you first have like a server, and you're going to first flex your arms, extend your arms, and then go back to normal. Then we're going to have you pronate and then supinate. Awesome. So now we're going to assess your wrist range of motion. So I'm going to have you have your palms towards you and then towards me. And then we're going to do ulnar, go back here. Ulnar deviation, so go towards your pinkies, and now radial outward. And then now that that's done, we're going to move on to your fingers and your thumb. So first you're going to do thumb and finger flexion, finger extension, finger abduction, and then back to normal. Thumb extension, thumb adduction, thumb abduction up to the sky, and then thumb opposition. And put each of your fingers. Okay, so now that we've done fingers and all of that jazz, we're going to move you back up to the table here. See? I'm going to lay that down. Right. I am going to be inspecting your hip joints, your ACEs, and your greater trochanter. I'm going to be assessing and inspecting your medial and lateral femoral condyles, and inspecting your patella, your patella tendon, and your tibial tuberosity, inspecting your lower leg, your calf, your medial and lateral malleolus, your Achilles tendon, your calcaneus, your tarsals, your metatarsal bones, your toes, your IP joints, and your IP joints. So now that I've done inspected, I'm going to now palpate these areas. So I'm going to palpate your hip joints. You can lay your feet flat for me. Yeah. Hip joints, ACEs, and your greater trochanter. I'm going to palpate down and palpate your medial and lateral femoral condyles, and your patella tendon, and your tibial tuberosity, palpating your calf and your leg, down to your Achilles tendon, your medial and lateral malleoli, your calcaneus, malleoli, your tarsal bones, and then your metatarsal bones on both sides bilaterally. And then I'm going to also inspect your toes and your IP joints. Here. Alright. So now I've done that, I will do the, since I guess I should have first done knee and hip range of motion. So I'm going to first start off with hip flexion, straight leg, hip flexion, and then bend your leg, knee flexion, and then we're going to do external rotation, internal rotation, and then knee extension. Whoa.
Every time.
Knee extension, and then I'm going to do adduction, then abduction, and then I'll have you flip to that side for me, and then I'm going to do hip extension on this side, and then I'm going to do it on the other side. So I'm going to first do this one, yep, hip flexion, and then knee flexion, and then we're going to do external rotation, and then knee extension, and then I'm going to stabilize this hip, do hip adduction, abduction, and now you turn to that side for me, then hip extension. Alright, cool. So now that we've done that, I'll now do, I should have done this the other way so I don't have to touch your toes and go back up and stuff, but lay back out. And then now that we're here again, I'm going to have you dorsiflex your foot. So just flex your foot and then point your foot. Awesome. And do that bilaterally. Flex your foot, point your foot. Okay. And then I'm going to also do inversion to eversion. So here, inversion, eversion, and then also I'm going to now do your toes. So I'm going to stabilize the MCP joint and have you point your toe, flex. Now flex your toe. Good. And then point your toe, flex your toes. Cool. Now that that's done, we're going to have you bend your knees real quick. I'm going to measure your circumference of your calf. So I'm going to measure at the widest point of your calf. I'm going to mark down with a pen, my imaginary pen, right here. And then I'm going to now measure from the tibial tuberosity down to that mark, and then go on to the next leg, go from the tibial tuberosity down, and measure right there, ensuring it's the same size. All right, it is. And so now that we have done that, I'm going to now measure your knee flexion, range of motion with the goniometer that I have in my pocket. So I'm going to have you stand as far back as you can. You could do 1 foot at a time. It's fine. Is that as far as you can go back? Yes! Alright, so now I'm going to place the goniometer at the lateral femoral condyle here, and I'm going to put one of the legs of it going down to her lateral mediali and her greater trochanter on the other, and it looks about 20 degrees on this. And then now I'm going to go onto the other side, go all the way back as you can at the lateral femoral condyle, do one to the greater trochanter, one down straight to the lateral mediali, and it's about 20 degrees as well. That is all.